Good evening, everyone.
Good evening.
It's a fantastic thing to have a reunion again after the COVID-19 protocol booking for a noble event. Just mute all. Yeah. So for a noble event, and this is the most important thing. And we all know the importance of the breastfeeding, its role, and how it has changed the whole perspective of the health of the baby, health of the mother, and health of the entire ecosystem. So for that reason, we have a theme for 2020, breastfeeding for healthier environment. So I would like to give a warm welcome to all the chief guests for today's event. So we have Dr. Ravi Shankar, who is a BPS president. Thank you for joining, sir. We have Dr. Shobana ma'am, who is a KSOG Kasoga president. Ma'am, thank you for joining. We have Dr. Tejavati ma'am, who is the BSOG president. Thank you for joining, ma'am. And then we have our IAP Karnataka chapter president, Dr. Shantaraj sir. And we have IMA president, Dr. Madhusudan sir. And from UNICEF, I would like to give a warm welcome to Dr. Sanjeev as well. Dr. Sanjeev sir, thank you for joining. And we have from our NNF Karnataka chapter, we have a president, Dr. Kotreshi sir, our vice president, Kishore sir, and the entire office of joint secretary from all across representing the entire pan Karnataka from east, now north, east, south, west, and center. So we would like to give a warm welcome for all of them. And we have three wonderful speakers today who they themselves are an institution, and they have decorated so many positions, and they have been a role model. They have n number of awards, n number of publication, n number of students who have got inspired and learned from them. We have got the senior most teacher, professor, Dr. Banapur Mat sir. Thank you for joining, sir, and accepting our request to teach all of us. We have Asha ma'am. Ma'am, you when it comes to breastfeeding, we always remember a few of the selected people, that is you, Banapur Mat sir, Malikarjun sir, and so many other people, who have been. And when it comes to human milk bank, it's such a great, difficult thing to set up everything from the scratch. And we have our legend lady today, Dr. Rupa ma'am. Thank you very much for joining, ma'am, and thanks for setting up Human Milk Bank in Belgaum. I mean, that's a phenomenal achievement what you have done. And so far in Karnataka, we have two Human Milk Bank, as far of my knowledge. So fantastic for initiating that process by all alone, and with setting up an example over there and for the entire Karnataka. Now I request Kishore Kumar sir to invite the chief guest and to speak a few words about the event. Kishore, Kotreshi sir.
Hello sir.
Yeah,
Hello.
sir, invite all the president and speak a few words. Over to you, sir. Kishore sir.
Good morning.
Kishore sir. Kishore sir. You have to unmute, sir. Unmute, sir. Kishore sir, unmute. Yes, sir.
Sorry, Dr. Kotresh Ilva.
Kotreshi sir, idhar sir. Please invite all our presidents and then let them speak.
Good evening, everyone. It's a great pleasure to have this session to celebrate the International Breastfeeding Week. I have the pleasure of inviting my own teacher, Dr. Banapur Mat, and Dr. Asha Benkappa, and the president of NNF, Dr. Kotresha, who needs no introduction, Dr. Ravi Shankar, IAP BPS president, Dr. Tejavati, KSOG president, and Shobha, BSOG, sorry, it's the other way around, Dr. Shobhana, who is KSOG president, and Tejavati, BSOG president, and Dr. Rupa Bellad from Belgaum for having the expertise of human milk banking establishment. And this is one best example where all of us come together, whether it's IAP, IMA, UNICEF, and NNF, BSOG, KSOG, for a common goal to promote the breastfeeding, which is the best lifesaver for the neonates. And we are yet to reach the single-digit infant mortality and neonatal mortality in Karnataka or in India for that matter. And we need everybody's cooperation to promote this in a big way. And thank you everyone for having joined. And I thank Dr. Nikhil for having representing the UNICEF and Dr. Shantraj for IAP Karnataka branch. And I invite everybody to this August forum to take this further. Back to you, Prashant.
Yes, sir. Thank you very much, sir. Now I request Kotreshi, sir, to speak a few words, sir.
Hello, sir.
Yes, sir. We can hear you, sir. Go ahead, sir. Yes, sir. Yes, sir. Yes, sir. Yes, sir. Yes, sir.
Good evening for everybody who is breastfeeding work overall the celebrating all over the world.
ನಿಮ್ದು ವಿಡಿಯೋ ಬರ್ತಾ ಇಲ್ಲ ಸರ್.
ಇಲ್ಲ ಮೊಬೈಲ್ ಅಲ್ಲಿ ಇದೆ ಸರ್. Okay, sir. Go ahead, sir.
And on this wonderful event, when we united, asked Prashant to go ahead with us under the guidance of Bala Pramat, we could meet together on this wonderful day to create the awareness of breastfeeding. You know, mortality has come down among us all by even by 2%, and we want to make it zero mortality in the newborn field itself. Graced almost like Dr. Pramat and Dr. Rupa Bella and Dr. Madhusudan Karinur and OBG fellows also. In this wonderful event, let us celebrate all together to create awareness on breastfeeding. And I invite especially on this everybody on this occasion, and I'm thankful for this occasion from KNF itself. Over to Dr. Prashant.
Yes, sir. Thank you, sir. Thank you, sir. Now I request Shobana ma'am to quickly say a few words about the event and the role. Over to you, ma'am. Ma'am, kindly unmute yourself, ma'am. Unmute, ma'am. Unmute. Ma'am, kindly unmute, ma'am.
Unmute ಮಾಡಬೇಕಾಗುತ್ತೆ ಮೇಡಮ್.
Unmute ಮಾಡಿ. Yeah, yes.
I was muted by the organizers. Okay. Good evening, friends. I am Dr. Shobana Patel. I am currently the president of Karnataka State of OBG Association. Few days back, Prashant called me and he said they are doing this webinar and whether Kasoga is interested in joining this. And he also told me that this webinar is being organized as a part of the awareness program in the World's Breast Feeding Week, and I readily agreed. And we have been hearing about this breastfeeding since the undergrad days, and to us it appears, and superficially it appears like, you know, this is such a natural instinct for the mother and the child, and why so much hue and cry about it. But today we know that there's so much more to it than what it appears. And also the theme of the 2020 has been the support breastfeeding for a healthier planet or a healthier environment. And I think this theme has got such a profound message for all of us. And also I was very happy when I saw the names of the speakers, and Prashant and his team has chosen such stalwarts in this field. And I thought this message must reach each and every obstetricians in Karnataka. And I must congratulate NNF, IAP, UNICEF, IMA, Bangalore OBG Society. All of us have come together to put up this program. And I appreciate really NNF is taking a lead and bringing up this kind of a program, because it has got a synergic effect. Why? Because one thing is, whenever we look at a problem, when we get a different specialty people to talk about it, we get a different perspective out of it. And secondly, it also reach out to a large audience. And I am sure today, like, you know, this program is going to benefit lot number of people who are joined to be there as a part of this webinar. I wish you all very best and a happy learning. Thank you very much.
Thank you, ma'am. Now I request Tejavati ma'am to speak a few words.
Good evening, everyone. It's really nice to share this platform with the neonatologist and the pediatrician and all the others who have joined in this big occasion, the Breastfeeding Week. I think it's very important for us, especially the obstetricians and the neonatologists and the pediatricians, to work in unison to provide or to get maximum benefit to the mother and the baby. And I think all of us agree, as obstetricians, we are the first point of care. I mean, the pregnant lady is in touch with us first, and the care of breastfeeding starts right during pregnancy. That is, when she comes, we check her breast examination, we do check whether she has a problem, flat or inverted nipples, and then we start counseling her about how important it is to get, the feeding part. And most of the problems, I think the first person they contact is obstetrician. So I think we play a very important role along with you all, of course, after we finish our job. And not only talking about the advantages about the baby, but also the pregnant mother, where she will be much benefited in prevention of breast cancer, ovarian cancer, and then decrease of gestational diabetes, and maintaining an optimal weight. So I think we should counsel her about this also, along with the great benefits on the baby. So I think we should continue this good work, and we have been doing a lot of activities this last few days. We did also a talk on live Facebook about the importance of to the general pregnant ladies. And it's not only this week, I think we should keep up this good work throughout and make sure maximum benefit is given to the upcoming generation. Thank you.
Thank you, ma'am. Now we request Dr. Sanjeev, UNICEF head, India. Dr. Sanjeev.
Am I audible, Prashant?
Yes, sir. Please go ahead, sir.
Thank you. I'm sorry I don't have a great video, and I would like to look handsome on video. As Dr. Banapurvat said, I cannot compete with lovely ladies. I'm sorry. So I'll just speak using my audio. So at the outset, I would like to thank National Neonatology Forum, our colleagues from obstetrics and gynecology community from different parts of the state, the Bangalore Society, the Karnataka Society, colleagues from different medical schools, and on the top of everything, Professor Banapur Mat. Means we all grew listening to his sessions on breastfeeding, and I remember my former chief, Dr. Yogendra Mathur. He often used to quote Dr. Banapur Mat when he was in Hyderabad for a very short time in 2011-12, and he said, "Why don't you engage Dr. Banapur Mat for improving breastfeeding coverage in Andhra, Telangana, and Karnataka states?" But I never got a chance. Often I heard his videos and also his articles. Anyways, so on this very important day, I think we are here for a very important cause, and we know what it is. UNICEF always from forefront has been supporting breastfeeding in all circumstances, and I'm happy that Prashant is able to get very important communities, our obstetrician colleagues, as well as our neonatologists and pediatricians at one platform. This is where we often commit mistake, or we are not able to achieve desired results because there is probably there is no convergence between, or there are little convergence between obstetricians. They continue to focus on mother and they hand over baby to neonatologist or to pediatrician. So sometimes, I mean, this is where our efforts, our endeavors fail. So I'm happy that you brought these two companies together and with their full participation. I'm also really happy to see colleagues from Indian Medical Association, because they have a much wider reach. They reach out to other specialties of medical sciences, and they have a larger, I would say, cloud. So, I mean, all important advocates are at one place, and we have such wonderful speakers today. So I don't feel myself qualified enough to speak anything on breastfeeding while these Professor Manapur Mat others are here. So I just congratulate you lastly and wish you good luck, and let's look forward for wonderful speeches. Over to you, Prashant. Thank you.
Thank you very much, sir. Now I request Ravi Shankar sir, our Bangalore Pediatric Society president, to speak a few words. Over to you, sir. Kindly unmute, sir. Kindly unmute. Unmute, sir. Unmute, sir. Kindly unmute.
Ravi, you have to unmute yourself.
Yeah, I am unmuted, ma'am. I think the time is up. Everybody is waiting to listen to the three great people who are here, Dr. Bana Pormad, Asha Madam, Dr. Rupa here. So I don't want to intervene much. And the only thing I congratulate all the association presidents who have come here and joined together for a good cause, including the two OPG, Karnataka and Bangalore. And that is one of the it augurs well to Karnataka. I think so. It augurs well because all are joining hand and doing a nice job. So hope this will continue in the future also. We'll work together. Sir, I'm very eager to hear to Dr. Bana Pormat, Rupa and Asha Madam. Please go ahead. And from IIT BPS, I will thank you for joining this webinar and give your learned knowledge to all of us.
Thank you, Ravi,
Over
sir.
to Prashant.
Shantaraj sir. Shantaraj sir is IIP Karnataka chapter president. Shantaraj sir.
Hello, hello.
Yes, sir. Yes, sir. Yes, sir. We can hear you. Go ahead.
Anything important?
Yes, sir. Yes, sir. Please go ahead, sir.
Yeah, thank you. I'm Dr. Shantaraj, President of IIP Karnataka. I'm very happy for such a nice program to be conducted. Dr. Bana Purmat sir is my teacher. I'm very grateful to him for whatever he has taught me. Because of the teachings, I'm a pediatrician today. And Dr. Asha, who is my classmate, and Dr. Rupa, and Dr. Shobana, my colleagues. I'm very thankful to the organization for giving us an opportunity to co-host this. I wish you all the best. This is something which we have to follow, and we have to follow in the whole country. This is our Nirmala Kesari Madam's brainchild, and I am very happy to remember her on this day. And it's only because of her efforts that things are going on like this. I want her blessings to continue for the next generation also. So I wish you all the best, Dr. Prashant and your team, Dr. Dinakar and team.
Thank you very much, sir. Now I request Madhusudan sir. He is our IMA Indian Medical Association President Karnataka to speak a few words. Over to you, sir. Madhusudan sir. Madhusudan sir. Madhusudan sir. I think you're unable to connect to him. And on this occasion, this platform wouldn't have been possible without the support of our Mr. Ganesh, who is a GenWorks chairman and director, who has been a phenomenal support to NNF Karnataka right from the time we have started our NNF Karnataka webinars. So on this occasion, I would like to thank him for all the support which has been giving for the academic activities, what has been conducted across Karnataka, across India. It's a wholehearted thank you, Mr. Ganesh. Ganesh, I request you to speak a few words quickly. Over to you.
Thank you, Dr. Prashant, and thanks to everyone who was speaking on this conference. And it's always amazes me, it always how you are able to do this. And I think for the last 4 to 5 months, the kind of activity that NNF Karnataka has been up to in terms of bringing in the best quality of education in terms of seminar or everything with partnership, which is an amazing thing to do. I've never seen, I'm not saying to praise this in front of all of you, but the most important thing is how well you collaborate with the other specialties to make sure that the training is holistic. And we are glad that we are able to play a very small part in this. We are just in the back end. And also thanks for bringing us up. It's very kind of you even to talk about us, though what we do is too small. But I'm really glad and happy to be part of this NNF Karnataka, and please count on me. We will certainly do the best together to take quality education, and such collaborations that you bring truly help to deliver quality education. I'm very thankful for that.
Thank you very much, Mr. Ganesh. Thank you very much. Now the countdown is already over. Yes, sir.
Prashant?
Yes, sir. Please tell, sir.
Just see, I am attending as an attendee. Okay,
Yes.
no, don't worry, I hear very much. Very good. Ganesh, really thankful to you. From the beginning, you are there with us. Mr. Ganesh, are you hearing? Okay.
Yes, sir.
There
Yes,
with
sir.
us.
Yes, I'm hearing,
Thank
sir.
you
Very much.
very much. Wholeheartedly, you are supporting our NNF Karnataka. Once again, I am telling. And even UNICEF, I don't want to tell once again, thank for the UNICEF Sanjeev, and as well as I think so. Shantaraju, sir, Shantaraju has joined. Please, I think so. Whether he has spoken, just see that
He spoke up.
number.
He spoke up.
Okay, so over to Prashant.
Yes, sir.
Asha madam, but
thank you.
Asha madam is there, so she will do the
Yes,
great
sir.
job. Sir is there, excellent, and even Tejavati madam and Shobana, they're all great teachers and seniors. Thank you very much. Welcome to one platform. Thank you for your really support, even IAP. So Ravi, thank you. Bye bye.
Thank you, Kana. Thank you.
Thank you, sir. Thank you very much. Now the countdown has started. So now I would like to introduce Panapurmat sir. It doesn't need any introduction because he's been a teacher, father of fathers. So thank you very much for accepting the request. And the request from all the audiences, they want to have more time for the discussion. So let us start the session. First talk will be done by Panapurmat sir. The second, followed by that, second talk will be done by Asha ma'am, and third talk will be done by Rupa ma'am. Then after that, we will go with a one-to-one discussion, group discussion. You can ask anything. I can openly say on behalf of our great teachers and seniors, who the legends in the field of pediatric, and especially when it comes to breastfeeding and the related things. Whatever doubts you have, we have 3 stalwarts who are ready to answer all the queries. So we have nurses also who have joined, who has been a great part in terms of promoting breastfeeding. And I would like to give a special welcome to all of our nurses who have been tirelessly working during this pandemic time. We owe your effort and hard work. Thank you very much for being with us for a lifelong partnership between the doctor and nurses in medical field. Thank you. So any doubts, any queries, anything you have related to breastfeeding, please ask our panelists, our speakers. They're wonderful and they've got the great knowledge. They've been pioneers in all this. And with the blessing of Nirmala Kesari ma'am, I request Banapurmat sir to please start the session. Please start the session, sir.
Thank you. Am I audible?
Yes, sir.
Hello?
Yes, sir. We can hear you, sir. We can hear you, sir.
Yes, sir,
We'll
you're
start the
audible.
session.
Okay. Can you see my screen?
Yes, sir.
Yes.
Yeah. First of all, I must say only one word. Prashant Gowda is an amazing person. As the secretary, Prashant Gowda, he has brought about everybody together, and that is what actually is needed when you talk about supporting breastfeeding. It's not one man job, you need an entire team. First of all, I thank him for this opportunity. I thank Kotresh and all people. Not able to go to the next slide. Some problem, I think.
Your slides is not seen, sir. We can see your video. Anviti?
No.
I can see
Anviti, I
it.
need to
Slide ಕಾಣ್ತಿದೆ ಸರ್ ನೆಕ್ಸ್ಟ್
presentation.
ಮಾಡಬೇಕು.
Yeah. Down on the left corner side, there is an arrow, sir. Left corner down. Screen, left corner. Down.
Sir, on your
Down.
screen, right at the
On your
bottom,
screen.
yeah.
On my screen.
Yes, sir.
This one? I
No,
should
sir, not
close
at
it.
the control panel. Not in the control panel. Right at the bottom of your screen, left side. If
Go
you
to
just take your
webinar.
finger there.
It says go to webinar. I'm already in the webinar.
No,
View
no, sir.
audio options.
No, sir, we can hear you. Sir, right at the bottom of your screen, below your name, I think left hand side, you'll see that next arrow. Very faint.
No, it's not seen. It's not seen.
Yeah.
That's the problem. I think I have to minimize the screen.
Sir, ಆಗ್ತಿದೆ.
Yeah.
Slide change ಆಗ್ತಿದೆ.
Okay. I thank all of you. And this is the time we have to remember our Nirmala Kesri madam. This picture was from the South Asia Pacific Conference on Breastfeeding. And the lady who is speaking is no more. Both the ladies are no more. Mariam Labak. She did excellent work on lactation amenorrhea method. Thank you all for the opportunity. Now let me quickly go through my slides. We all know what is the best for the baby to be fed is human milk feeding and breastfeeding. These two terms are a little different. I'll explain that later. They have immediate as well as long-term benefits for all babies, including the preemies, the preterm and low birth. Now, feeding small and sick newborns. Now, NNF, really, you are at the helm of affair because 20% of babies born in our country are small and preterm. It's a huge load. And who is taking the brunt? It is the army of neonatologists who have come up in a very big way all over in all districts of Karnataka. And I really am very pleased to be talking on how we are going to help the mothers. Now, the smaller the baby and a sick newborn, they have immaturity or a medical condition, it will interfere with effective oral feeding. We have to remember that. Mother and baby are separated. The tiny ones often need care in a special or intensive care unit. It results in separation. It's additional challenge. The staff who care for these babies, they require specific competencies, knowledge, skills, training, ongoing training, and improvement in their skills on a day-to-day basis. This is an excellent word I picked up, early total enteral feeding. This word must be repeated. ETEF stands for early total enteral feeding is safe. It decreases the incidence of infections, including NEC, enhances the brain development, reduces the days on parenteral nutrition, and shortens the time to achieve full feed. So let's remember this word. Mom-made milk, mother's own milk is mom-made, is a first choice for any baby. Now, what are the roadblocks? Let's see, we'll go one by one. Small babies, there is a delayed initiation. There is infrequent breastfeeding, delays the establishment of breast milk supply. It decreases the milk supply, and all these in turn lead to breast milk substitutes. So it is like a cascading effect. So what should we do? If the baby is small, cannot suckle at the breast, yeah, it is important to express. When? As soon as possible, starting with colostrum within an hour of birth to support the onset of lactation. What is early initiation in an NICU? It's all right if it's a term baby born, the breast crawl can be done. It's a different issue, but we are talking about the small ones. Let me read out this definition. Provision of breast milk to infants within 1 hour of birth. It is referred to as early initiation of breastfeeding, and it ensures that the infant receives the colostrum first milk, which is not only rich in protective factors, it's also rich in minerals and micronutrients. This picture you can see the woman who had just delivered long ago in 2003. A drop of colostrum is seen. When you continue, you can see the milk flowing all along, though it is in small quantities. These two pictures I had taken within 5 minutes of the mother having given birth. So there are many mothers, our Auschwitz colleagues will also have they will have leaking of the breast even during the baby, during the antenatal period. Now, what are the steps for expression? I think this is the most important part of my topic. What are the steps? I thank Anita Namgowda. She has shared these excellent slides for me. First step, wash your hands. Keep a sterile syringe, sterile spoon, cup ready for expression. Mother should sit in a comfortable position. She gently massages her breast from the base of the breast towards the nipple. Find the correct place, about 1.5 to 2 inches from the tip of the nipple. That is where most milk is stored. As this picture shows, using the thumb and index finger, expression should be done. You have to, again it is shown, you have to press back towards the chest wall and not towards the container. It is press back, squeeze and release, squeeze and release. It is such a procedure that it will, even if it is done for hours on end, it should not hurt the mother even once. It's a very gentle technique, but it's a very powerful one. Our nurses must get trained. Collect the beads of colostrum. This is how. Choice of collection device depends on, you have to use the syringe to collect the beads, or you can use a cup, or you can use, as has been shown in this picture. Move the hand all along the breast to express colostrum from all quadrants of the breast. After this is done, repeat on the other side. After the expression is completed, replace the syringe into a wrapper or place caps on the container. Label it properly. Mother's name, appropriate identity details are important. Store the colostrum. If more amount has been, you have been able to remove. It can be stored in a room air for about 8 hours, 8 hours easily. Refrigeration for 24 hours. Freezing for much longer periods. Now what the mother, now let's come to this situation. The baby is delivered, but the baby gets into an ICU. Now, expressing the colostrum, we have gone through the steps. The mother expresses her colostrum. She should be allowed to tempt her baby with a few drops. Access has to be provided if the baby is stable. She can also leave a soft cloth with her milk next to the baby. The smell of her milk has, there's a research showing that it's an excellent thing to be doing. Changing the diapers of the baby, taking care of the baby, touching the baby, trying to talk to the baby, all these things you have to involve the mother more and more, because she is the best carer for her baby in this world. Nobody else can come near to her amount of commitment and amount of intensity. When the mother has delivered a newborn baby, how much they become alert and how much they are protective to the young one. You can see it in the whole animal kingdom, including humans. Soon she will learn. Remember, the baby belongs to her. Now, how to go on? After colostrum, once in every 2 hours, once in every 3 hours. So nearly about 8 to 12 times in a day, including day and night, she must be encouraged. It should be a painless process, as I have already emphasized. This will result in no disruption of lactation and milk supply. Milk collection and storage, you have to be very careful. Hands must be clean, containers must be clean, there should be no contamination. Hygienic milk collection and storage and handling practices are important. What do you do now? If you have not been able to do that, then the WHO recommends. UNICEF are a great party of this. I was very happy to hear, Sanjeev from UNICEF. He made an excellent remarks. Pasteurized donor human milk is the second best option. However, this option cannot be recommended everywhere. It's only where a milk banking facility is available or can be set up. What about use of formulas? Okay, the use of formulas is the next option when a neonatologist or a pediatrician or the gynecologist or the people taking care of the baby, first and foremost is they have to counsel the mother and the family. Sometimes mothers are not very mature enough, they are confused, they are worried that what is going to happen with my small one, will it survive, will it live? So she's going through a lot of problems in her mind. The family elders must all be taken and they have to have a counseling session. My My close friend and colleague Guru Prasad has set great standards in counseling in the NICU. He makes it a point. In fact, his counseling sessions are much longer than his NICU rounds. It's a great thing that he has done. He's involved everybody, the nurses. So that is, now preterm formulas are also available, but they are very costly. So only those who can afford, and the baby is not gaining weight on the routine formula, standard formula, only then this can be recommended. Please remember, it is very costly. Now, the point we will come to is what is most important. I am not going to give a lecture. My point is only on practical points. We as a team of neonatologists, nurses, we have to keep the mother and baby both in mind. You have to give focused and optimal immediate support to the mother. To initiate and establish breastfeeding in the first hours and first few days, it will have a positive effect far beyond the facilities, for long-term effects are there. What is our requirement from the mother? She should be able to express breast milk whenever it is required. That has come in the last and it is in red because that is the most important thing. Mother also should be enabled to achieve effective breastfeeding, which will include they should be helped with positioning, attaching their infants to the breast, responding to their infants' hunger and feeding cues. When all this is not possible, expressing breast milk, mothers can do amazing work. In our NICU of Bapuji Child Health Institute, though we don't have the support of a human milk bank, the need for turning towards the human milk bank, we did some study and it was less than 5%, 3 to 5%. Because when mothers are encouraged, they are amazing people. Every mother is a human milk bank for her newborn. She is able to express much more than what the baby needs, provided she is supported, counseled, and helped. Expression of breast milk is something which we all have to learn. Take this as a very, very important step. Very important step. It's a technique used to stimulate attachment, effective suckling during the establishment of breastfeeding. Sometimes it may take a couple of hours or a few days. So not only where the mothers and infant are separated, not just at that time, even if the mother and baby are together, you still need to teach expression. How to create support for the mother? We'll come to the next step. Mothers of an infant, where the infant is admitted to the intensive care unit, first thing is they should be sensitively supported to enable them to have skin-to-skin contact with their infants as early as possible. They should be supported to recognize their infants' behavior cues and effectively express milk soon after birth. Spend adequate time. This all doesn't happen overnight. It takes a lot of dedication. Some nurses are so amazing; they can spend hours on it. You have to just encourage them. They do wonders for us. Spend adequate time with the mother to help her with latch and milk transfer. The baby will need adequate jaw support. I'll show you some nice pictures. This is called the dancer's hold. See how the baby is supported, the jaw is supported. This could be underarm position. This mother is not only holding from one hand, cross arm, the thumb is also assisting the mother, assisting the baby to get milk into its mouth. This is one more position. Okay. Supporting the mothers to respond in a variety of ways. Respond to the behavioral cues for feeding. Provide comfort or closeness. Enable them to build a nurturing relationship with their infant. This will increase their confidence in themselves. Most important. You have to build the confidence of the mother, and this is going to take a lot of time. With the increasing confidence, they will become more confident about their breastfeeding, the supply of milk, and as time progresses, they will also appreciate the growth and development of their infant. KMC Nothing much can be said. It's an excellent, no cost technology. Shashivani madam and her team all over the India, they have done excellent work. Santosh Nimbalkar and their team. KMC can be practiced. This is something and a great intervention that all neonatologists have to remember. Try to facilitate extended skin-to-skin contact. It stabilizes the newborn's heart rate, respiratory effort, better temperature control, thermoregulation, the blood glucose, metabolic stability, all that is taken care by just keeping the baby and mother together. What a wonderful thing to happen. It paves way for early breastfeeding. You can see this is, the baby has a rice tube in its mouth, but still the mother, so much of pleasure on her eyes and the way she has kept the baby. Wonderful. These are skin to skin contact. The mother gives 3 precious gifts to her baby. What are those? One is her milk. Second, her skin contact. And the third, her time. And the last one is the most important. Neonatologists are busy making rounds, busy looking after the sick newborns. One baby becomes sick, they have to be rushing around. The residents are rushing around. But now you need, the mother is the person who has all the time in the world. We have to use her in our armamentarium. Mothering is an art. Now you have to teach the mother how to respond to the infant cues. Breastfeeding, skin-to-skin contact, cuddling, carrying, talking, singing a lullaby, so forth. Just holding the hands of the baby, holding it close to her bosom. All these things are very important. Sorry. Now comes the question. You need decide that you want to give additional milk. Additional food and fluids apart from breast milk should be given only when medically accepted reasons are existing, like galactosemia, or the baby has some surgical condition and you have to put the baby on parenteral nutrition. But for those few things, lack of resource, staff time or knowledge are not justifications to use early additional foods or fluids. Please remember, this is a very important slide with an extremely powerful message. When you think of additional milk, please go back, turn the clock back, look at what has happened. Have you done enough? Have you counseled the mother? Have you taught her expression? Unless you do all that, there are other techniques also when additional milk is required. I'll come to that. For example, if the mother is taught how to use the U grip, as has been shown here, and when the baby is at the breast, she also assists the milk transfer. This is something great. The American breastfeeding medicine has an excellent issue on that. When the neonatologist feels that the baby is not gaining good weight, you want to solve that problem. This is a wonderful technique which has helped quite a few babies. Okay, ongoing care is important. It just can't be in the first few days. Constant communication with the staff and the parents and family. Change of plan. Sometimes the baby becomes sick. Now you have to have a constant communication with the mother and the family. Evaluate breastfeeding at least once by a senior person and once again in the evening by the next who are in the ladder rung. Latch score, I'll not go into the details. Infant breastfeeding assessment tool is another way. Mother baby assessment, these are all tools available. What is important is the baby should get a good amount of areola into its mouth and the baby should remove milk. Monitor the voids of the baby, temperature on a 6-hourly basis, weight records on a daily basis, pacifiers and bottles. Use of pacifier and bottles, if anybody is doing, that person is doing this service. Proper guidance and counseling of mothers and the entire family members enables them to make an informed decision. Kishore has done excellent work with Cloud9. He says, whenever informed decisions, this is something we all have to learn. Mothers must take an informed decision. Use of avoidance of pacifiers and or feeding bottles and teats should be strongly discouraged. Please, I'll repeat that. It should not be used at all. And if it is being used, it is going to come in the way of successful establishment of breastfeeding. You are doing disservice. Milk substitutes, there should be no promotion of breast milk substitutes, feeding bottles and teats in any part of the facilities, providing maternity and newborn services by any one of our staff. Feeding bottles and teats, they should remember that it comes under the International Code of Marketing, and for our country is the Infant Milk Substitute Act. It was revised in 2003, enacted in much early 1993, and it was revised in 2003. These resolutions, international resolutions, should be highly respected because it has not come from the pocket of a person. People have sat together, spent days, weeks, met repeated times and come out with international guidelines. Training of health workers. More, you can't say overemphasize this relevant training. You have to have relevant training for your nurses, which is essential for your problem to enable quality standards to be implemented effectively according to their roles. Every person will have a different role. All of them have to be taken into. Minimizing disruption of breastfeeding during the entire stay in the NICU, later on till the baby gets discharged. Throughout that time, providing maternity newborn services will require the healthcare practices. They should enable the mother to breastfeed as much as she wants, as frequently as she wants, and as long as she wishes. Now, restricting her entry, make sure that she washes her hands, puts on the sterile gowns, and then she should have a good access to her baby. Preparing for discharge. Before I go to that, I would like to just tell about one person. In the year 2003, we were in Arusha, Tanzania for the World Breastfeeding Week International Conference. And I was sitting next to an elderly person. And later on, we just started talking to each other, and he said his name is Adik Levin. My God, I said, you are Professor Adik Levin. I have read so much of your work. He has done Humane Care Neonatal Initiative. He is the first person who wanted to bring in a humanity in NICUs. It's an article which is worth reading, rereading, and I was so happy, that you have to enable mothers. Preparing for discharge is again a big chapter. Mothers should be prepared for discharge. You can't just discharge them and send. It has to make sure that the care for continuing breastfeeding support is there. The breastfeeding support is also available for succeeding days and weeks after discharge. That will be crucial in identifying and addressing early breastfeeding challenges that may occur. They will occur. In fact, this is most important. The baby is delivered in Bangalore, it will come back to Tumkur, it will go to Gulbarga, it will go to Davangere, it will go to Chitradurga. So we have to have support all over. Now, you'll be surprised why I have put antenatal preparation here at the end. In fact, it should have come much earlier. There is a reason for that. The reason is parents should be offered antenatal support much earlier. Yeah, Madam Shobna Patel, she was really mentioning, as well as Tejavati, antenatal preparation from very early pregnancy. You have to give tailored individual needs, sensitively given to them, and considers their societal, cultural context. This is very important. Now, a mother would not like to bear herself, expose her breast. You have to be very sensitive, give the proper, in social context, antenatal education has to be given. You have to prepare them for challenges they might face. This is an extremely important point. Now you will know why it has come. It has come here because what Prashant Gowda has done today, you need coordination. That is the need of the hour. You need coordination of the obstetricians, the midwifery people, pediatricians, neonatal services, IMA, UNICEF, all people have to come together. That is why antenatal care, I have put it here. It's like a teamwork that improves the outcomes for using them. Last 2-3 slides, you can see in our NICU where Guru Prasad is heading. These are pictures taken several years ago. The lady in that pink dress, oh, they are amazing. The way they can teach mothers with attaching, expressing. And then once the mother is already learning that, she will teach the other mother. It's like mother to mother support. And you can see that even in the nurses not there, they continue to do their work. Now, I would like to summarize last 3 slides. Anticipation. What is this? I have made a mistake there. No, it's purposely done. Antenatal care. From there you have to start. Help the mother to express colostrum if the baby gets separated. Relieve the anxiety of the mother with counseling techniques. Explore early KMC. Avoid teats. And as you step down from the NICU, you have to increase the support. Breastfeeding support has to, inversely, it has to go on increasing. Now, what is this QIP? Quality Improvement Program. Ashok Devrari, an excellent neonatal NNF president. We have listened to his talks and his work on QIP. There is scope for each one of us in our day-to-day NICU setup. You can go on improving your quality in a small graded fashion. You don't have to do everything all of a sudden, but QIP, Quality Improvement Program, is something which will involve the IAs, the ward boys, the nurses, the technicians, everybody all together. And that is how, and the residents, the postgraduates, interns, then only quality improvement program can happen. The last slide is slide colors are reversed. Pearls. What are the pearls? First one is, I will emphasize early total enteral feeding. That is the first pearl. What is early initiation? Oh, mother is, baby is in NICU. No, nothing like that. Wherever the baby is, wherever the mother are, within 1 hour, the colostrum has to get into its gut. That is early initiation. Focused and optimal immediate support in the first 24 hours, 72 hours, 5 days. That is focused and optimal immediate support is the key. For that, skin to skin contact, kangaroo mother care. No, there are residents who may feel it's not my job. All that should be done by the nurse. I would only tell them, because our NNF fellows, I would only tell one thing. If you want to become Raja, pehle rank banna sikho. A person who wants to become the king, first he should learn the job of the Sipahi. That is, only then he will come ranking up in his job. From technology driven NNF, you have to take knowledge, very basic knowledge. I have taken my talk to a very, very basic level. You have to have trained counselors. You can't import them all of a sudden. There are trainings available in our country, Pondicherry, Hindupur, now in Lucknow, Ranchi. There are so many places. 7-day courses are available. The NICU should become a Tavrumane. What is this Tavrumane? Tavrumane is the place where the parturient mothers find mental peace. I call that as Tavrumane. If all her anxiety is relieved, that is the real Tavrumane, warm chain. And in my last slide, I'll be very happy to show this slide. You see this lady, her baby was 1.2 kg at birth. Its baby is sucking so well, you can see. And the way she holds, she's so confident. Wow, it's something amazing to see all these things happen in an ICU. Thank you very much. Thank you for the opportunity.
Thank you very much, sir. Wonderful. I mean, that's why you have been called a BAP of all the stalwarts. Thank you very much, sir. Now, I request Asha ma'am, who's going to talk on the World Breastfeeding Initiative theme, that is breastfeeding for healthier environment. She doesn't need any introduction. She's been a mother of the breastfeeding initiative in the entire country and one of the founder of IYCF Infant and Child Feeding. Thank you very much for accepting the offer. To teach all of us. Over to you, ma'am.
Ma'am, could you unmute yourself?
Okay, congratulations for collaborating, connecting, compassionate, concerned organizations on this e-platform. Our biggest challenge is Dr. Prashant Gowda and Dinkar because they have done a wonderful job. I will put them as challenges because they have to move forward and enhance the breastfeeding capacities because they're really challenged. This is a memorable event which will go down in history for generations. Let's hope and pray that next year would be a COVID-free World Breastfeeding Week. And from this event, we should have a lot of spillover effects. Over to my slides. Okay. The topic, full screen the topic for me is on the theme. It is rather tough because it's going to make you you have to sit back and think because we as pediatricians, we are not used to this kind of a discussion. So the theme is support breastfeeding for a healthier planet. It means ಸ್ತನ್ಯಪಾನವನ್ನು ಪ್ರೋತ್ಸಾಹಿಸಿ ಭೂಮಂಡಲವನ್ನು ರಕ್ಷಿಸಿ. And we have just one planet. We don't have many planets. Unless we get into an emergency gear and act, we are going to lose our planet. As I speak, you will know what I'm trying to tell you. So planetary health has been defined as the health of human civilization and the state of natural system on which it depends. Breastfeeding is the key to all of the United Nations Sustainable Development Goals. The interconnected nature of people and planet requires that we find sustainable solutions that benefit both. 2 years back, the theme of the World Breastfeeding was about Sustainable Development Goals. Planetary health needs sustainable action to combat environmental degradation and climate crisis. Breastfeeding is linked to all of the Sustainable Development Goals and is key to achieving sustainable development. It is in our hands. We don't have to approach any politician, bureaucracy, or government agents. We, the obstetricians, I'm so happy that our obstetric colleagues are here. The obstetricians and neonatologists and pediatricians, the power is in our hands. Please see that you do something. See that by the end of next World Breastfeeding Week, we have higher initiation rates, breastfeeding percentages increase. What is the other thing? Emerging trends in global health and nutrition. So much of natural disasters. Infectious disease outbreaks like the present COVID pandemic. Healthcare system is challenged. I wrote a series of articles called The Healthcare Industry is Critically Ill, from infrastructure to staffing, equipment and physical facilities. We had to convert an international podium for the care of the COVID patients. That's done, but we don't have human resources. Overnutrition and undernutrition is a double-edged sword. I'm very worried after the end of this COVID pandemic, how many of our little ones are going to be undernourished. We are going to have, ladies and gentlemen, we have tough things ahead of us. And the non-communicable diseases which have come up now because breastfeeding was not a priority on earlier days. The protection, promotion, and support of breastfeeding before, during, and after emergencies poses the greatest challenge to which we should all step up and gear up. Sustainable food systems include breastfeeding. Look at the food production, the food we consume. 20% of it is greenhouse gas emissions, which is responsible for the global warming. The globe is so much warmed, it's urgently appealing to all of us. Please help me, save me. 32% is global soil acidification, 78% over-mineralization of water bodies. Our current food production and consumption practices are degrading land and water ecosystems and driving climate change. Just now, Dr. Banapu Verma was talking about how there's no other alternative, according to me, except breast milk. And breast preparation of breast milk substitutes contributes to the problem of climate change. Breast milk is the first food that we consume and a critical part of a sustainable food system. Infant feeding methods matter. He was talking about the feeds, the feeding bottles, the nipple. In IMS Act was passed in the Indian Parliament in 1992. Amendments, including internet promotion, was done in 2003. So feeding with breast milk substitutes from the farm to the table affects the environment and climate. Scaling up optimal breastfeeding prevents that many child deaths and maternal deaths. Breast milk production only requires that 500 extra calories we give to the mother, which is not much of a environmental degradation. Despite so many years of action, there is slow progress on improving breastfeeding. Globally, 40% babies are exclusively breastfed and 40% continue any breastfeeding up to 2 years. Look at the institutional deliveries. We made a big mark there, 79%. Initiation of breastfeeding within 1 hour is only 41%, and within 1 day, 81%, and at the end of 4 to 5 months, it's just 41.5%. Since our obstetric colleagues are here, please ensure that the women have a broader cot to deliver so that the baby can be put immediately on the breast. I did a small project for the Malaysian workshop, and we find that the cots are at height and less broad, and they are very scared to put the baby in the skin-to-skin contact, and also the dress. They come with tight dresses to the labor ward. Please see that the dresses are comfortable. Maybe something cots will think over, put on your thinking caps. Then what are the ecological footprints of breast milk substitutes? Dairy forming in the carbon trap, energy sources and carbon emissions, waste in our environment. Breast milk substitutes do a lot of water footprints. We are not able to execute the Paris Agreement regarding water. It used to be told that the next World War is all about water, but unfortunately it became a COVID pandemic. Ecological footprints of breastfeeding. By breastfeeding for 6 months requires just the 500 calories we are going to give the mother. Saves an estimate 95 to 150 kg of carbon dioxide. Comparing the carbon footprints of breast milk substitute and breastfeeding, breast milk is zero waste, zero food waste, no tins, no plastic, no electricity required, 0 liters, zero greenhouse gas, zero water footprint. But now the world is coming up with what is called as the green feeding advocacy campaign. We need to protect, we need to promote, we need to take care of this mother and baby and ensure that they are not pressurized by the commercial companies. It needs enhanced, upgraded community support. And by supporting breastfeeding in the UK, the savings gained is equal to 55 to 77,000 cars off the road per year. Breastfeeding is nature's way. As the trees turn to the sun, babies turn to the mother's breast. Such is nature's way because that's got a very strong rooting and sucking reflex. Breastfeeding is eco-friendly. It's the most ecologically sound food, valuable natural resources, produced and delivered to the consumer without pollution. It has positive effects on the environment. It's a lifestyle choice. It's a health issue for mother, environmental issues. We know that breastfed infants suffer fewer diseases. The idea that breast milk should be replaced by an artificial substitute has been compared to suggesting that dialysis machines should replace human kidneys, which are both a waste of resources. to continue, positive effect on environment, doesn't cause pollution, there is no waste in breast milk. Suckling conditions the quantity of milk produced. It is supply-demand cycle. Breastfed babies excrete less often and need fewer nappies. Less use of disposable diapers and related disposal. The last institute where I worked, we used to generate 30 kgs of disposable diapers from the neonatal intensive care. And cost of disposing them was tremendous, and they continue to stay in the soil. They absorb a lot of water, and the water content of the soil is lost. An average Indian mother lactates for a period of 2 years and produces 346 liters of breast milk during this period. Just by this, India would save 176 crores on treatment of diarrhea and 500 crores on family planning method because of the lactation associated amenorrhea. This is the economics. Just look at it. The annual births in India currently is 27 million. And all these calculations I've bring it down to the bottommost part of the slide. And in that, bottommost part of the slide, total cost of breast milk comes to 1,578 crores. The only extra food is the 500 calories we are giving this lactating mother. Lactating women do not menstruate for 6 months. They do not use sanitary napkins. 98% of them are flushed down the drain. Those who are using our water feeding counterparts, 300 tons of paper per year save on sanitary production packets. The plastic liners on this sanitary napkins are not biodegradable. They remain as pollutant, they are microplastic, and they cause a lot of problems in the ocean. Coming to bottle feeding, it is eco-hostile. It is responsible for 1.5 million infant deaths and illness in country, countless others every year. 15 times more diarrhea, 6 times infections. Packaged baby milk waste resources such as tin, paper, and plastic is to the 86,000 tons and 1,230 tons used for paper labels, feeding bottles, nipples, and equipments. They're all not recyclable. This is the latest statistics. In 2016, breast milk substitutes 26,900 tons was sold, and in 2021, the projection is 30,700 tons. BM comes to a new classification. Breast milk substitutes come to a new classification, which is called as the NOVA classification, which is detrimental and which determine on the processing of the food. Whereas earlier days we were talking about the amount of carbohydrates, protein, and fat, but now the NOVA classification is talking about the processing of the food, and breast milk substitutes top the list. Oil is the key resource to manufacture plastic. Manufacturing plastic creates pollution. Plastic is virtually indestructible and remains forever as a pollutant. Baby milks are the end product of a number of industrial processes. The energy used to require high temperature and mechanical procedures cause air pollution, acid rain, and greenhouse gases. Use natural resources as fuel. Uses milk and packaging materials often travel considerable distance before processing. Once ready, transported, countries exporting milk cause considerable pollution, water bottle streets, etc. For example, a 3-month-old bottle-fed baby needs 1 liter of water for mixing feeds, and each artificially fed baby needs at least an extra 73 kgs of firewood per year. We're talking about the rural women. Now we'll have to talk about the gas. Promotional materials use a lot of papers. Dioxins are produced in the manufacture, disposal, transportation, etc. Artificial baby milks contain high levels of aluminium and lead, and many other ingredients may be contaminated with dioxins. There's a new organism called Enterobacter sakazaki. The moment you open the tin, at the edge of the tin, you have some little blackish thing. These are called Enterobacter sakazaki. We don't have any medications for them. These children land up with severe diarrhea and death. So in India alone, we need 135 million lactating cows to replace the milk of women. If the women said, no, I will not breastfeed. I am on a war. I do not want to breastfeed my child. 43% of land is devoted to pasture. Forest land has to be cleared. Deforestation, depletion, erosion, and increases in gas which contribute to greenhouse effect, depletion of ozone layer, global warming. The gas let off from the cows, flatulent and extra, add to the atmospheric pollution. 100 million tons of methane gas is produced every year. Rearing of cows contributes to the problem of acidification of air and acid rain. Nitrate fertilizers used to grow feeds for cows reach river and contaminates the groundwater. Similarly with fertilizers and animal sewage. Processing and transport also causes a lot of environmental pollution. For want of time, I'm not going to read every bit of it. It's left for you to just go through it. So the impact, undermining of breastfeeding leads to destruction of natural resources. Just imagine the simple art of breastfeeding the baby is going to save the only planet we have. If baby food industries continue to promote bottle feeding, it will reach catastrophic proportions in the future. Human milk from the mother is directly delivered to the child at no extra cost. Dairy industry milk, cow, maintenance, milking, you need servants, collection, transport, vehicles, initial and running costs, and look at how it moves. From the vendors, we have from the vendors, distribution, parents, prepared food, etc. This algorithm is there in my book. For want of time, I just want you to know how the milk travels and how much of atmospheric pollution the milk is causing. True breast. This is a wonderful poem I read years ago in pediatrics. So if we have a concept of tube breast, it's a revolutionary new method of infant feeding. Is ready in an instant. Less work for mother. Lullaby sound unit. Baby a soothing heartbeat he or she has grown accustomed to while nursing baby's lull to sleep. These units are unbreakable since baby cannot drop it on the floor. Quick fill holding tank stores baby's milk at just the right temperature, never too hot, never too cold. It has a feature of automatic refill, never bother with formula again. Baby less hungry than usual, no need to refrigerate leftover milk. It stays warm and sterile in unit, ready when baby needs. True breast nursing units never need sterilization. Quick, clean nipple. Remember, the nipple of the mother's breast is so good that in every feed, in 1 minute, the child has 60 sucks, and if the baby has 10 sucks, imagine how well that nipple is protected. It is lubricated by the secretions of the Montgomery glands, and it's a wonderful nipple that will not tear off. But if we don't take the right technique, we cause sore nipples and such a painful curse for the mother. There's no need to boil these nipples. They are made of guaranteed lifetime material, and it cannot be accidentally pulled off and choke the baby. But that's not all. True breast units solve the problem of storage of baby items until next baby comes along. We all have the habit of storing our first child's clothes for the next child, the clothes, the toys, etc. But in breast, you don't have to waste a space in the cupboard by storing them. They're there on the mother's chest. They're decorative as well as functional. They come in all sizes, shapes, colors, and outward appearances. These have nothing to do with ability of unit to function. Units comes in pair and improve with use. True breast make traveling with baby easier, the no mess, the no worry way. With this true breast around, why bother with other methods? We have a new pandemic. The new pandemic is breast milk substitutes. Overtly, covertly, and subtly, it's being promoted in the present pandemic. The ultra processed foods, anytime, anywhere, ready to eat. COVID-19 pandemic has added 130 billion disposable marks per day, which it's impossible to destroy microplastics. Increased hazardous waste like personal protection equipment, gloves, discarded sanitizers, bottles, headgear, etc. Oh God, how do we save this planet? Breastfeeding saves energy, plastic, biodegradable waste, gasoline, etc. I'm just last slide. District-wide COVID waste generated. This was what I got from the Common Biomedical Waste Treatment Facility. Look at this. At one end, we are crying our voice hoarse and saying, by breastfeeding, we will protect the planet. And the COVID pandemic is generating so much of waste. I'm really very concerned and worried. And for this young mother and baby, the best investment is breastfeeding. And the best insurance, health insurance policy you can give them is breastfeeding. Thank you very much. I just took 2 minutes extra, Prashant. Sorry for that.
Thank you very much, ma'am. I mean, fantastic, and it has been wonderful that. Am I audible?
Yes, yes.
Yeah, it is fantastic that both of the speakers have maintained the time. Thank you very much for that. And wonderful lecture. I mean, the topic of healthier environment with breastfeeding. It's a fantastic way of covered, ma'am. Thank you very much. Now I request Rupa ma'am to take the topic on role of human milk bank in pandemic, COVID-19 pandemic. Ma'am, over to you, ma'am.
Yeah, thank you, Dr. Prashant. Am I audible?
Yes, ma'am. Yes, ma'am.
My slides are seen?
Yes, ma'am. Yes, ma'am.
Okay. Yeah, good evening. Good evening, everybody. At the outset, I would like to thank Dr. Prashant, NNF, and all the organization presidents for giving me this opportunity to be part of this platform. It's really very honor for me to share this platform with my teacher, Dr. Banapurmat sir, and senior Dr. Asha, and all of the seniors there. So it's really very, I mean, I'm very happy today to share my little experience what I have in human milk banking. All of you are referring as legend and expert and other things. Let me tell in the beginning, I'm not an expert in this. I'm just a learner. I've just started putting my foots in this particular area. So with that, I would like to start my presentation. Now, as we all know, this pandemic, COVID-19, has brought in unprecedented presidential challenges, both globally and locally in India also, in all the areas, especially so with maternal and newborn health. And when we are talking about newborn health, newborn nutrition, breastfeeding is the most important thing. So it has disrupted the feeding in the newborn. And since human milk banking is a direct link to promoting, protecting, and supporting breastfeeding, there are a lot of concerns about human milk banking during this pandemic. So let's see what we know about this pandemic and breastfeeding. Now, breastfeeding in any other emergencies, we know that it is very, very important because it prevents thousands of deaths, especially the infection-related deaths in the low birth weight babies and other infants. And we know that more than, you can see the numbers here, under 5 deaths can be prevented only by promoting breastfeeding. And so the risk for death also is reduced by just promoting breastfeeding. And so during this particular pandemic, there is recommendation to continue with breastfeeding wherever it is feasible. The concern is about transmission of this virus through the breast milk, and whatever little evidence is available today from China and from other countries, there's clear-cut evidence that there is no transmission of this virus through the breast milk. And also there is no documentation of vertical transmission of this virus. And they have found, some of the studies have found that antibodies and some factors in the breast milk may help the infant to fight against coronavirus infection if it is exposed. So here we need to, there's one prediction, one study which predicts that if we don't look at these interventions in neonatal health, almost more than 70% of the deaths that goes in millions would be related to I mean, especially in newborns and in infants, would be we increase that amount of death in the infants and the children in all over the world. So we have to look at the benefits of breastfeeding against the potential risks of acquiring COVID-19. And with that in regard, there is promotion of breastfeeding and recommendation of breastfeeding during this particular pandemic. So let's look at how is this human milk banking different during the pandemic? What's its role during this pandemic? And we'll look at certain recommendations and a little bit about my experience of human milk banking during COVID-19. Now, majority of the professional bodies, including WHO, CDC, ICMR, and all the milk banking associations all over the world, including our Human Milk Bank Association India and IYCF chapter of IAP, with NNF, FOXY, all the organizations have looked at this particular pandemic very early. WHO started giving the guidelines way back in February, when even before we started looking at the patients with COVID-19. So the recommendations have evolved with the evidence, and they are going to be evolved. So what are those recommendations? They say breastfeeding has to continue, but with due precautions. I will not go into the details. We know what precautions the mother has to take if she is stable and she is able to feed. If suppose she does not, she is not able to give direct breastfeeds, express breast milk is the next alternative, and somebody else has to feed the baby. If these two options are not available to the infant, to the newborn, especially the sick ones and the most vulnerable ones, pasteurized donor milk is the one which is recommended by all the organizations. And once mother is able to feed, to support relactation and to continue with breastfeeding. So that is what is the recommendation. Now the question is, why this pasteurized donor human milk? Sir was telling that each mother herself is a milk bank, definitely. But till that mother is able to feed her baby, pasteurized donor milk is the one which is going to help these infants to survive, to sustain life. And we know a lot of literature is available to say that pasteurized donor milk is really a life-saving resource which is available to all the newborns, especially the low birth weight ones and the sick ones, thereby reducing the mortality in these infants because it reduces the risk of sepsis. We know all those advantages of donor human milk. So this becomes more the risk. I mean, the advantages would be manifold during an epidemic where the risk for infection is more for these vulnerable infants. So now, how is this different? Milk banking different from that previous to the COVID-19 pandemic? So there are a lot of questions which are asked, especially there are a lot of concerns, how safe it is. That is one of the major issues which have come up. And suppose we want to give donor milk, the availability and other challenges in this and the recommendations. So these are the major differences we find today in human milk banking. The concerns, as we all know, the first major concern is the risk of transmission. So since we don't have many studies saying that there is no risk, but whatever have been coming up definitely say that there is no risk of transmission. The concerns are about the safety measures in handling the milk, disposing the milk, and screening of the donors, availability of the donors. What is happening in the hospitals today is the admissions have come down, the deliveries have come down. So the donors are basically from the postnatal wards and in the OPDs. Since the policy of early discharge of these postnatal mothers very early and decreased OPD patients, the availability of donors has become a major issue here, and the feasibility also, because in our country, I think many newborns require this, especially during the pandemic with the separation of the mother, and how feasible it is to provide this to all the infants is one of the major concerns. Now, we have guidelines from Human Milk Bank Association of India and IYCF chapter of IAP and PATH. This is in accordance with other organizations, and they recommend that there is no alternative to human milk. It has to be given. Because, as I said earlier, to vulnerable small infants, because we can reduce the mortality in these babies. And we know that there is no transmission. And also one interesting point the literature says is that with heat treatment for 60 degrees for 30 minutes, there is thermal inactivation of this virus. And so if we pasteurize this human milk, there is no transmission of virus in the milk. So that's really very good evidence for us. So if there is babies are not able to access their own mother's milk, either directly or through express milk, then the next option would be feeding these babies with pasteurized human milk. That's the recommendation. And also to support human milk donation as per our national guidelines for the lactation management. So there is no change basically. Only thing that there are certain precautions to be taken, especially for the donor screening. So a lot of vigilance, lot of precautions need to be taken when we are looking at the donors in the milk banks. So apart from the routine screening criteria is what we use, looking at the health of the mother, there are reports of HIV, HPSAG. So all these reports, apart from that, we need to take a proper history and examine the patients and document the details so that we rule out whether that particular donor is a suspect case or a probable case of COVID-19. So these mothers, we make a list of mothers who are not eligible, like COVID positive mother, definitely not eligible. Even if there is a history of mother staying or transit through a high containment area in previous last 14 days, history of contact with a probable case or a confirmed case in the last 14 days, and if she has some symptoms like cough, fever, sore throat, running nose, symptoms suggesting COVID infection, and if suppose she has worked in a facility where anybody is diagnosed of COVID-19. So these are the criteria which are being used to screen the mothers before they donate the milk. Of course, once we take the milk in, the process is also looked up with very strong vigilance. Strict hygienic procedures are being taken care of through and through the process of milk banking, that is for the collection, pasteurization, storage, even the dispersal of these the dispersal of the milk, and meticulous record keeping is also been done. That's very, very important. And also we take care of all those disinfective procedures, hygienic measures, disinfecting the floor, surfaces, handles, everything would be taken care more vigilantly during this particular pandemic. Most important is to avoid the group counseling, because that's the usual practice for us. We group the mothers in the postnatal ward, in the immunization clinic, try to counsel them about advantages of breastfeeding, and also counsel them to donate the milk. So that needs to be avoided during this pandemic. And mass donation, community collection of the milk is definitely not indicated during the pandemic. And for motivating and counseling mothers, many of the centers use the telephonic modes or the digital modes. And most important, as I said, there is inadequacy of the milk today because the donors have decreased. So there's shortage of the donor milk. And what the recommendations say is, don't dispense milk for each and every baby who is in need, but reserve that for the vulnerable babies, the sick babies in the NICUs. So we have to ration the milk today, the donor milk, so that we can provide it to the most needy and vulnerable babies. So those were the recommendations, and that is what I think all over the India, many centers follow that. Now coming on to the challenges, that's easy on paper, easy to tell, but what is happening actually on the ground? Now there are a lot of challenges. COVID, as we know, is definitely an era of challenge. And so this is not only happening in India, it is happening all over the world. And to look at it globally also, a lot of efforts have been done. Now, one of the good thing which has happened is in somewhere in February, March. So all those leaders in milk banks, they formed a group called as the Virtual Communication Network of Human Milk Bank Leaders, wherein even we, many of us from India participated, and we formed the group wherein more than 80 members from 37 countries, we came together to share our information and best practices, and basically discuss about how do we combat this challenge, how to see that the milk flows, the donor milk is provided to all the needy infants. If you look at this figure here, more than 800,000 infants receive donor milk all over the world. And with this, we brought in the discussions, and it was published in May in Lancet Child Health, Adolescent Health Journal. So this is the network where we go on discussing about the challenges and provide some means, share the experiences so that we know how to take care of these challenges. So there are a lot of challenges, as I said. Basically, the major challenge what we have found out is difficulty in getting the donor mothers, because as I said earlier, because of the early discharge and less of attendance in the OPD, closure of the well baby clinic, it has become really very difficult to get the donors. And also questions about how safe it is, these milk, the donor milk, while it's been handled for pasteurization and for disposal and also for the transportation. And one more major issue in many of the hospitals is inadequacy of the staffing, either because of the lockdown or because they have been posted for COVID duties or the health issues of the staff. The staff has become inadequate, and many of the centers are closing down because of this. And of course, there is increased demand because of the separation of the mother and the infant today. So these are just few of them which I have mentioned, but there are many, many of these issues. And each center is trying to take care of these challenges in their own ways and see that this donor milk is provided for the needy ones. Now, I would like to share our experience, very little bit of experience. Ours is a non-COVID hospital, and recently it's been converted into COVID hospital. And as mentioned, we have started our milk bank in 2018. So we are very young, and this was inaugurated by the Honorable Minister. And what we have done is, as soon as we started having the pandemic, we developed a screening questionnaire in addition to the screening questionnaire of the donor mothers, wherein we put all those criteria to screen, because it was not possible to look at there was no availability of the testing of this particular milk. So we put up the screening checklist for the history and for the areas what the guidelines provided us, and started screening the donors. That was the major thing which we brought in once we started having the pandemic. And later on, as we went on getting more number of cases, what we did was, of course, there was no substitution for breastfeeding and expression of the breast milk. All those low birth weight babies in the KMC ward, we tried to motivate the mother, counseled and gave her the support to start breastfeeding her own baby and also to express the breast milk. So we encouraged that first. And where it was not available, we provided the donor milk. And also we recruited those donors with the checklist who were supposed to be negative. And has been reported by all other centers, the collection came down drastically. And of course, we started getting these asymptomatic mothers, and we are not accepting the milk from these mothers, and we reserved the milk for the vulnerable babies. It's same as any other center. So if we look at our statistics last year from January to July and this year, you can definitely look at the number of donors. It has drastically come down. And the worst was in April and May. We hardly had any mothers to donate. So that was the impact of COVID on our milk bank. Even the amount of milk collected also came down drastically. Now what's the path forward for milk banking? Lot of questions are unanswered, and lot of research and sharing has to be done to look at many of the issues, like can we recruit asymptomatic mothers as donors? Then as soon as the mother becomes swab negative, can we take the donations? What happens to the community longitudinal donors? Screening criteria for cross-sectional OPD donors, can we do that? And what about facility for testing this in human milk? There's so much of lack of facility, so can we use it for the safety concerns? And what strategies are there for the future if this pandemic progresses? So there are a lot of unanswered questions, but one thing is very much sure, that we need to continue to provide human milk, either direct breast milk or express breast milk or pasteurized donor milk to our needy babies, and to support lactation, because that is what is going to help our babies to be healthy and to have a healthy newborn. So that is what, but the strategy has to be of feeding with donor milk has to be very much restrictive, and it has to be provided to the vulnerable and small and sick newborns. So together today, I think I can very happily put this slide on, that wherein all concerned with the newborn health, baby's health, feeding issues, infant nutrition, all of us, if we come together, we can ensure quality of care for our moms and babies, especially during this pandemic. Thank you. And this is our team at our milk bank.
Thank you very much, ma'am. Wonderful presentation and lot of insight on the problems and challenge to what we are facing right now. And we have been having a lot of questions based on that itself. Thank you very much for the wonderful presentation, ma'am. So I request all the three speakers to unmute themselves, and we'll take up the question. And I request all our attendees who have been attending the webinar, more than 100 people have been attending webinar. So I request them to kindly post the questions and doubts you have. Our expert speakers will take up one by one. The first question is, what will we do in case of corona positive case if mother is positive and baby is negative? Shall we proceed breastfeeding or stop? This is the first question. So any of our speakers can take up. Ma'am, Rupa ma'am, we would like to take first.
Can you just repeat that question, Dr. Prashant?
If mother is COVID positive and if baby is negative, shall we proceed with breastfeeding or stop? That is the first question.
If the mother is positive and she's stable, she is able to directly breastfeed the infant baby, she can continue to breastfeed. Okay, but only thing, she cannot stay. Some of the people say that baby cannot be roomed in with the mother, but definitely she can directly breastfeed the baby with the mask on and other things. Yes.
Okay. Okay. Ma'am,
Can I add
Asha
my-
ma'am? Yeah.
What we can do is, there should be a separate room for this positive mother and the baby. Earlier we did that with the cradles. Now we may have the cradle in her room, and it should be kept at a distance of 6 feet. We maintain that social distancing. And when she's feeding, she will wear the surgical mask. Then she will use the sanitizer, feed the baby, and put him back in that cradle. Because, Prashant, except the mother, nobody else will take care of this baby. The 320 COVID positive mothers who deliver their babies are all on lactogen in Vanilla's hospital. And it was it came out on the television that we are using lactogen for these babies. Do you know what is the future of these babies? Number one, what happens to this mother? Because physiologically she is primed to breastfeed. Once the placenta is expelled, she is going to have breast engorgement, abscess, and so many issues. Breast conditions are worse than labor pains. So we have to collectively think that some place will get for them with a mother and positive mother with a negative baby will stay together at a distance of 6 feet.
Yep. Thank you, ma'am. Banaput sir, would you like to add a few things for this, sir? Banaput sir? Sir, kindly unmute, sir. Anviti, can you unmute Banaput sir?
Yeah, he's actually self-muted.
Yeah, can you unmute him? Is it possible for you to do it? Yeah. So we have, yeah. Sir?
I'll call him. You can move on to the next question, so I'll call him.
Yeah. Okay. So the next question is, for how long a newborn can be kept hungry before breastfeeding is available, especially in this special situations? If I think ma'am has already answered both of them, Rupa ma'am and Asha ma'am. Would you like to add few things on this, so that there are a lot of nurses who have joined as well, so they'll carry home the message. Ma'am, Rupa ma'am, and then Asha ma'am can add on.
Yeah.
For how long?
You cannot starve the baby. You have to start as early as possible, as per the recommendation. It all depends on how stable the mother is. Okay. So if the mother is stable, it is as good as any other mother. So she has to start as early as possible, because early breastfeeding is what is more important.
Irrespective of any situation,
My-
because they're asking
Yeah.
about the pandemic. Asha ma'am, yes ma'am.
There's something called as suckling hypoglycemia. If we are talking of a term baby, the term baby is endowed to put up with the delayed initiation of breastfeeding. The longest is 48 hours, and up to 24 hours you can wait. So we should not get over anxious and try to stuff in something into his mouth. About the preterm babies, of course, I believe more in giving them something other than the formula. Maybe you can take them to the NICU and put them on IV fluids rather than making that wonderful sterile gut unsterile by introducing all this BMS.
Okay. Thank you, ma'am. I think still Banapurmat sir has not got unmuted. Yeah. The third question is there any evidence that COVID-19 positive mother produces antibodies which gets transferred to baby by breastfeeding?
Yeah. There is one reference. There are 2 or 3 references from China and other European countries which say that the antibodies and some bioactive agents are transmitted in breast milk, and even there is secretory IgA shown in breast milk of those mothers who are COVID positive and being transmitted. Most of the reports say that the newborns acquire this COVID-19 by the exposure to the mother rather than through the breast milk or other means.
Okay. Asha ma'am?
I echo the same sentiments. We're getting a lot of reports where there has been transmission, and we had put it up in the IYCF group, that there is a lot of transmission of antibodies through the breast milk. So positive mothers produce antibodies. It's nature's way of doing it, just like in the HIV pandemic. We know that cell-associated cell-free viruses, and there are some antibodies, I'm forgetting the name of that antibody, that's produced in the breast milk for the HIV. Just think that we are in sort of like a HIV pattern situation, then we'll slowly start getting the answers. So definitely there is antibodies produced against the COVID, and the production of antibodies takes as little as 12 to 15 hours because there are multiple bioactive substances. Just like we talk about prebiotics and probiotics, so we have the substrate, the mechanism has to be stimulated.
Okay, so Banapurmat sir. Sir, can you unmute, sir? Unmute yourself. Unmute, sir. Unmute.
So he's having.
Yeah. Yes, sir. You have to unmute, sir. Yeah. I think there is some technical issue with sir. We'll move on to the next question. That is, sir, are you able to? Yeah, I think there is issue with we are unable to hear you, sir. Yeah, the third question, the one more question which has come up is how to motivate the mother to give breast milk for human milk bank. Like how blood bank, there are NGOs which promote blood donation. So that is what they have given an example. But how it works with
Yeah,
human milk.
Prashant, I have one.
Yes, sir. Yes, sir. Yes, sir.
Yeah.
Yes, sir. Sir.
Go ahead. Go ahead. Yeah.
Yes, sir. So the next question what we have got now is how to motivate the mothers to donate human milk for the human milk bank. Rupa ma'am, would you like to start first, and then I'll request Bharat to add.
We do at our centers. We have dedicated nurses who are being trained in counseling, especially counsel the mothers for the lactational support and also counsel for donation. The best thing they tell us, if you give milk, donate milk, you will be producing more milk for your baby. That's one of the thing which restricts onto the mothers, and they say, yes, I want to donate. And majority of the mothers on the third day, from third day to fifth day, they have engorgement of the breast, okay, the fullness. So they want to get relieved. So that's one of the factors which makes them donate. So there is a means of counseling them. We usually do the group counseling, especially just before the immunization session when we have. So we group these mothers in a room and try to talk about advantages of breastfeeding. We do breastfeeding counseling basically, and also at the end we say there is something like this, and this is very, very important for other babies that you are donating your milk. So we get into these issues, start asking. They we get the counseling. During the counseling session, we make them get involved into talking about advantages of donating the milk, and somehow they get convinced, and so far nobody refuses to donate the milk, even during the pandemic. Only thing, we are avoiding the group counseling now. We do individual counseling. We have a dedicated nursing staff who does this in the postnatal ward, in the OPD, and in the labor room, so that she motivates them and gets them to the milk bank. That's how it's working for us.
Yeah. Could I add a point there, Rupa?
Yes, sir. Yes, sir. Yes, sir. Yes, sir. What do you say?
What I would like to suggest is, there are many mothers who get discharged from the NICU with a small and tiny baby and they go home. I was mentioning that ongoing support is very important. Here we can get our donors. See, your small baby got better. Now your milk can help other babies. That is one way of supporting. Dr. Ketan Bardava from Surat, he always has an excess milk supply because he has, I don't know about in the last 3 months, maybe there also it would have come down, as Rupa shared her wonderful slides. But they used to contain campaigns. Large number of mothers come over, and it's a big mega event, and the surplus of milk will be there in the milk bank. It all depends on how nicely, not only counseling in the NICU, even after discharge, because once the baby has got well, the mother gets more motivated to, donate the milk.
Just want to add on to what sir has said. What we do is, once they discharge, they come back for the follow-up, for the low follow-up and the NICU follow-up. Many of the mothers come back to the milk bank, as you said, sir, because of their experience in the milk bank, and they donate the milk. That is also a way of getting the milk that we have established. And community donation, we have not ventured into it. We were supposed to do it this year, but because of the pandemic, we have not done. But what I hear from other milk banks is they have totally stopped the community donate camps for the
because of this pandemic. Because of the pandemic. Yeah. Next
Asha
question.
ma'am, would you like to add few things, ma'am? Asha ma'am?
I don't have anything to add.
Yeah. So the next question is,
Before we go to this question, I wanted to add a little about the previous two questions.
Yes,
Yeah,
sir.
one of the participant asked, if the mother is positive and the baby is negative, can this baby be fed mother's oat milk? The answer is very much yes, 100%, because according to the WHO guidelines, there is no evidence that through breast milk the virus would go to the baby. On the other hand, protective antiviral antibodies get to the baby. If the mother is seriously sick, then you need to express her milk. If she is well, you have to early start rooming in, and all the 10 steps of BFHI should be put into place. But the problem we are facing is, in a COVID world, they don't allow any help to be given to the parturient mother. They would not allow one more person to come in. They say this is a COVID ward, only COVID patients are. All these things are coming across. Yesterday, my friend called from Kumbakonam. 35 miles away is Tanjavur, where the mother delivered the baby. Baby was sent back to Tanjavur saying that we will not allow the baby here. Now, this is very wrong practice. The WHO has clearly brought out the slides that you must start early, give KMC, keep the mother and baby together, but teach hand hygiene, respiratory hygiene to the mother. Okay.
Yeah. So the next question is from a nurse actually. How can we protect ourselves while helping the mother expressing the milk and handling the express breast milk and handling the baby?
Okay. This is a very, very practical question. It's very important that our health workers and we as doctors, pediatricians, neonatologists, first, we should protect ourselves as well as we should protect spreading the infection from one patient to the other patient. These are serious concerns. What has to be done is, if you are dealing with a COVID positive mother, if she is COVID positive, whenever the health worker comes in contact with this lady, they have to be doubly cautious. If there is any aerosol generating procedure going on, they have to have full PPE. Otherwise, they have to have a good face shield and a long gown with gloves. Then they will make sure that they will be protecting themselves as well as helping this mother. In fact, now the situation is no family members will be allowed near her. So the responsibility becomes double for our nurses now.
Yeah. Asha ma'am, would you like to add?
Yeah, recently I was in a webinar with Lawrence Grummer of the World Health Organization. It strongly says that it should be a hands-off technique in teaching the mother. Whatever you want to do with the mother, please do hands-off. Please maintain 6 feet distance. Take a doll, take a breast model and teach her, but never get yourself into a dangerous situation. So it's very, very, I'll put it up in the group what his statement is.
Rupa ma'am, would you like to add?
No, I think sir and madam has told. Yes, the health worker can take all the precautions and try to help the mother.
There is one more interesting question, ma'am. They have asked, is there any lactation course available for us to become an expert and get a certificate from a recognized both Indian or international association where the nurses can apply and become a lactation expert? How can we get the help?
Yeah, there are various courses available. In our own country, there is a 7-day IYCF counselor specialist course. Dr. Faridi is running it in Lucknow. Manjubala Dash is doing in Pondicherry, as well as there is one course going on in Ranchi. So these don't happen very frequently. Now in the COVID epidemic, they have all got into the background. But otherwise, courses are available. But if the person is really interested, they can go for a higher course. IBCLC is another online course. A person can go on improving their knowledge, take the exam, and get a IBCLC recognition. That is International Breastfeeding Lactation Consultant Association. So that is also available. But what I feel is we should not wait for these courses to happen. You should start in a very small way. That is what I said, QIP. Whatever is happening, your problems are there, try to solve them one by one. Ongoing training, improving the capacity of our nurses and the senior nurses handing over their skills to the junior ones. Is that what is possible, feasible, and it should be going on, improving day by day.
Sir,
ma'am, would you like? Yeah.
Okay. Yeah, Dr. Asha.
Yeah. Please go ahead.
As far as BPNI is concerned, if you go to the BPNI website, they regularly conduct courses for nurses, doctors, and lay counselors, dietitians. And as far as IBCLC is concerned, I wanted to do this course. It is nearly around 3.5 lakhs.
Oh.
So I don't think majority of our nurses can enroll for this course. And I was finally told by the committee that there's no need for a pediatrician to do this course, but it is just a fancy thing, you do 3.5 lakhs and like that. But it's a much changed course in the UK and US.
Okay.
Yeah, what I just want to add is the BPNI, I think on the website recently I saw an online course for the same program, what to do it. So I think if anybody is interested can just look into it, bpni.org, wherein there is an online during the pandemic.
No, Prashant, what I would like to add is excellent documents are available. Nurses who show interest, they should be handheld, build their capacity with small skill building. They become more and more, energized and enthusiastic. And with time, they all start getting better and better. Of course, the courses are not very frequent. Once in a while it happens, but you should not wait for them.
Okay. Yes, ma'am. And for an effective establishment of breastfeeding in the institution, what are the tips or infrastructure which is required? And I mean, from from doctor to nurses to parents, how the flow should go. That is what they've asked, to setting up of effective breastfeeding initiative in the hospital, how to go about.
So wonderful question. Yeah, wonderful question. What I suggest is, you please, I will share the document, that is, the WHO has come out with implementing the revised BFHI in 2018. It's not a very lengthy document. It's very practical, very easy to read, very easy to teach your nurses also. And you must aim that every NICU facility, maternity facility starts working for. Now there is no BFHR recognition as such being done by the country, but we should not be waiting for any certification. We have to go on improving. Now this is an excellent document implementing 2018 BFHI updated guidelines. I will share the document to you, and it can be, it's available on the net. It's a wonderful document.
Ma'am, would you like to add? Kindly unmute, ma'am. Yeah. Yes, sir.
BPNI also has a wonderful document on the Baby Friendly Hospital Initiative. I'm just sending it to the group.
Wonderful. Wonderful. Yeah, you already have it.
I just want to tell in a simple thing. One most important thing is required is the commitment. Commitment by everybody, starting with the administrators to the nurses, to be part of this. That is very much important. The policies are there, the programs are there, but to implement it, we require a lot of commitment by all of us, and communication. Communication is another important thing which is required to make this successful in any hospital or an institution.
Yeah, wonderful point. Just to add to that is a very simple but extremely powerful point. In our day-to-day work, we will come across successes, simple successes. A mother is helped by a nurse to latch on the baby. A mother is helped by a nurse to expel breast milk in a painless way. All these things will come to the consultant's notice. That should be magnified, and the success must be celebrated. That is the best thing to be done. And all the credit should be given to the nurses and paramedical staff as well as to the mother. That is how you build their capacity. So Prashant,
yes, sir.
Prashant, I wanted to add something else. I was busy trying to forward that. See, in Vanilla Children's Hospital, which is supposed to be the largest maternity unit, the 1,400, 600, sometimes 1,800 deliveries. Every Thursday, I used to make a lactation round. So as Rupa said, we need a committed team of people, and it should be the same staff nurses. We had a team. I still remember Bibila Mirajkar and Nirmala's sister. So the sisters will always used to come for the lactation round. And it used to take such a long time, because in one day it would be anywhere from 60 to 80 deliveries that would have happened. And in that one lactation round, you could have seen all the breastfeeding problems and the happy mothers. That's a success story, and they bless us. And so the team was committed, motivated, and then they also knew that we had a 24 hours helpline in the newborn OPD. I was one of the persons who was instrumental in establishing an exclusive newborn OPD connected to the NICU. So all the time the help was available, all the time there was a doll in the breast module. So like that we were able to do that. The second one, my paper which got published about the role of female birth attendant. every mother who comes with her daughter to the antenatal checkup and subsequently in the labor ward, we had trained them with a laptop about the various position attachment and all that. From a mere 60% rates in Vanilla Hospital, we were able to bring up the initiation and continued breastfeeding up to 85%. And still remember 15% were not breastfed. So there was a lot of spillover effect. The mothers, the female birth attendants in their community would go back. They knew that there was a lactation clinic there and these kind of things. But it needs enormous commitment, perseverance, and less of politics.
Yeah, lactation is an excellent idea what Asha has just now shared with us. It can be done even once a week or twice a week. It has excellent impact, no doubt about it. One more point I could add is you can designate one nurse to keep simple statistics in the NICU. How many mothers were helped on that particular day, and you review it on a weekly basis or a monthly basis. Now, it's an excellent way. The quality improvement program would happen by a periodic review. You don't have to aim at the stars. Aim brick by brick. We should, build our successes, and within 6 months you will be finding yourself, oh, wonderful work is being done. This is what is my message to all the neonatology fellows in India as well as in Karnataka. We have a large army of this 1-year fellowship of neonatology, which is really taken in a big shape. They must be undergoing a 7-day course. That course is what we are trying through Rajiv Gandhi Health University. Because of the COVID, everything went into the background, but it will happen sooner or later. All NICUs must implement this. It will be an excellent thing to happen.
Sir, this question I hate to ask, but they have asked. But what are the contraindications for human milk? Human milk. I don't want to ask, but still they have asked. The attendees, so we have to respect that.
There are only 3 contraindications. One is metabolic disorders like galactosemia, is a clear contraindication. Second, if the mother is on radioactive compounds or antifolate metabolites, cancer patient antifolate. Barring these 3, there is no contraindication. If the mother is HIV positive, tuberculosis, hepatitis, typhoid fever, any damn thing is not a contraindication. So remember the 3 things. One is a metabolic disorder like PKU, galactosemia mainly. PKU is a relative contraindication. And mother is on antithyroid drugs, antifolate, as well as she is on radioactive compounds. But for that, there are no contraindications. But in good you have asked this question because controversies and problems must be clarified. This is the best platform available to all.
Yeah. Others, ma'am, would you like to add few points?
No, I think sir has told that. So absolutely there are no other contraindications other than what sir mentioned. Basically metabolic disorders.
There is one more.
As far as if the mother is on anti-metabolites, you have to study the biological half-life of the drug. There is a book called by the World Health Organization, Breastfeeding Drugs and all that. So she's on a metabolite, and if that metabolite maximum is excreted, say, at 8 p.m., and at that point of time, she's supposed to remove that milk, and the next milk, will not be having this metabolite. So I had a mother who had this phyllodes, one breast cancer, and one breast was removed. She was on antimetabolites. When we explained this to her, these are all anecdotal, single experience, and she was doing the job so beautifully well. She also recovered, and the baby did very well on breastfeeding. So the biological half-life of the drug to be calculated, and the breast milk to be expressed, flown, and you get the subsequent flow of milk is bereft of that metabolic.
There is one more practical question. In a primipara, we have observed that on day 1, the milk production will be almost nil or very minimal. So usually it starts from day 2 and day 3, which you have experienced. So what we should do on day 1, day 2 till the milk production gets better.
Morning we had a discussion on this. I would like to repeat the same thing. I wish the breast are made transparent for the next generation women. Okay, so that everybody can see this milk. Unfortunately, cholesterol is so thick, so juicy, so tasty that it needs that 150 centimeters of pressure to powerfully pull out that milk from the mother's breast. There is a hypothetical plug at the tip of the nipple. We used to have those Scott soda bottles, you remember? So that has to be pulled out. So you cannot see that milk. Dr. Banapur showed us the secretion of cholesterol. Okay, so it is what the mind doesn't know, the eyes doesn't see. So all we do is just put the baby to the breast. The cholesterol cannot be seen, cannot be squeezed, can be sucked by the powerful sucking reflex of the baby, which is very, very strong in the first 4 hours of birth. Please do not give anything. And even if 24 hours, the baby doesn't get anything, nothing will happen. And the second and third day milk coming in, what they're talking about, it is about the hormones in harmony and hormones at war. So the progesterone and estrogen that were in the mother's breast all through the pregnancy, suddenly you're ignoring them just because prolactin and oxytocin came into the scene. So the war between the two hormones and the fury to settle down, it takes 48 hours. And then the milk starts coming out when the estrogen and progesterone start coming down. It is estrogen and progesterone which is keeping the milk like that. And once the level starts coming down with frequent breastfeeding, then everything will be in place. For heaven's sake, nothing is required. Even a priming mother, the entire process of pregnancy is for the preparation of the mother to breastfeed the baby. You know that she gains around 8 to 12 kgs, and out of that 3 kgs is for lactation calories, which is deposited on the breast of the mother. It's just on the hips of the mother. It is just our knowledge gap and our skill gap. So in Vanulas, I used to tell the obstetricians, please send them to me, madam, I'll make the milk come. And lo and behold, the milk used to come.
Banapur
One
Yes,
point
sir.
to add it to the person who has asked this question. It's an excellent question faced by all pediatricians, obstetricians, neonatologists all over. Oh, milk is not there. Milk is not there. First day, second day, third day. Now, what do you do to do that? The answer is very simple. If you have put the baby to the breast soon after the childbirth by using a breast crawl, number one. Second, after you have made your evening round, whoever has seen the mother in the postnatal ward, alert the night staff. This is a very important point. Alert the night staff. What she should do? ನೋಡಮ್ಮ ಈ ಮಗು ಅವ್ರ ಅಮ್ಮನ ಪಕ್ಕದಲ್ಲೇ ಇರಬೇಕು, ಅವ್ರ ಅಜ್ಜಿ ಹತ್ರ ಕುತ್ಕೋಬಾರ್ದು. Keep the baby close to the mother. In the night, that fellow will wake up once in every 15 minutes. We have seen this happen once in every half an hour. In the daytime, he will doze off and sleep. In the night time, the babies are alert. The suck is vigorous. More amount of prolactin is released. And if you do it for 2 nights, problems are solved. So I would simply say this. Start breastfeeding in the labor room. That night, the nurses who are there in charge of these mothers, they should do this night frequent feeding. The problems, 95% will sort out. Why 95? All problems will sort out.
Yeah,
Thank you.
ma'am, like to add?
Yeah,
Rupa ma'am?
to add about one of the practice which we see very commonly, which makes them think that there is no milk. Everybody comes in and squeezes the breast and says that no milk,
No milk.
even the doctors. So
Correct.
that's one of the practice which makes mothers think that her milk is not coming in. So this is, as we know, cholesterol is thick. We cannot see the secretions. We only have to encourage the mother to breastfeed. That suckling is very important. So that's what has to be emphasized to the mother. And of course, we need to check the technical aspect also, the position. And
Very true, very true. Again, we come to BFHI only.
yes,
Yes, sir. There is one more question. Is there any helpline for the mother for
Asha is the
lactation?
right person. She conducts a helpline, telephonic helpline.
Prashant, I'm the founder trustee of a unique helpline called Lactation Helpline. And many people know about They say my voice is echoing. Am I all right now?
Yeah, voice is fine, ma'am. Go ahead, ma'am.
It's echoing.
So, yeah, they say I don't know what to do about that.
Because softly, it's echoing your voice.
Yeah. So I have a lot of people, I get mails. They are like national helpline. So now I have my daughter-in-law also, who's a trained lactation consultant. We have been doing a lot of that now during the COVID pandemic. So my number is easily available, and most of my services are free of cost. So this is a helpline. And Vanuvilas Hospital, I don't know what's happened. The OPD clinic has the 24 hours helpline with a lactation clinic, which is run every day.
Yeah, just Prashant, I just want to add, of course, it's not been, published to the public yet, because we are doing it as an NIH research grant, where we have developed a mobile app to be used by the health workers to promote breastfeeding, and a helpline attached to that app. So that we are going to publish shortly, and hopefully it will be taken up by many organizations. So that's shortly going to be released.
And recently, Dr. Arun Gupta started this Karnataka app, and he is also doing some helpline mobile apps which will help these mothers. DPNI is going forward with that.
True.
Yeah, they've asked about the duration of human milk that can be stored in human milk bank. For how long you can store in milk bank?
Yeah, we store it in the freezer. It goes up to 6 months, 3 months to 6 months.
6 months, yeah. I think there's a WHO guidelines as well on room temperature, on freezer, and in the milk bank. They can log in.
Bank, yeah. In the pasteurization room and the storage room, we maintain the temperature of the room with the thermostat, and we see that it doesn't go below that particular temperature. And regular checks would be there for the infection control, and even for the quality of milk which is being stored.
Yeah, I think most of the questions have been covered. I think it's a never-ending topic, sir.
Yeah, I just want to add one point. Very last point.
Yes, sir.
The last point is this. Maternal health is important. Maternal health is health, number one. And the baby that he has delivered, the baby's health is in the hand. NIC. Can I go ahead? Yeah. First,
yes, sir. Yes, sir.
Now, first point I would like to say is mother's own health is the prime concern. Throughout the pregnancy, throughout lactation, and all that. Maternal health. The second is the baby's health. From the time it is born, from the time it is completely, it is sent back home as well as followed up. Lot of disturbance.
We can hear you, sir.
The last and the most important point is breast health. Now, breast health has not been understood very well by all of us. If the breast has to stay healthy, milk from the breast must be periodically removed by its baby. Now, that is where we all have to do a lot of technicalities, building the capacity of nurses, talking to the mothers, making sure that they are understood all that. Unless they are comfortable with breastfeeding, they should not be discharged. It may not happen in a government hospital, but we should try for that. And lastly, when the mother is going home, the nurse who helped her should give her mobile number. That would be wonderful. That would be wonderful, because they will have such a nice rapport. So that is one thing: is the baby's health, mother's health, and breast health. Okay.
So yes, sir. Yes, sir. I think they have requested for. Can we have a course for nurses, online courses for lactation counseling? I think that will take up sitting together with our the bodies as well.
That is the right way forward. Please go ahead. Any number of people available to help, and it can be definitely.
We can do it, Prashant. We can do simple sessions, like the way you are doing the wonderful webinars. That will go a long way, because no time ever in our career we're going to take this kind of time. You know, we seem to be having all the time, and you're doing a wonderful job, and your webinars are quite easily reachable. So you can just think, put up some topics, and we'll all work on it, and do a course, and we'll say this is the NNFK nurses course.
Sure, sir. Sure, sure. I think this topic is a never-ending topic. We keep on getting.
Barking in the background. Close now. It is saying
Yes,
that
I want a closing remark on this auspicious occasion, which has been celebrated all across the globe. It's a worth celebration because that's a nature way of celebrating the love between the mother and baby. So, Banapurmat sir, your remark on that, sir. Last remark before we close the session from your side. On this occasion, what you would like to tell, sir?
Please repeat your question. I didn't get it.
We are about to close the session.
Whoever
Yes,
might be muted.
Yeah, Anviti, can you mute all?
Yeah, please ask me.
Yeah, so we are going to close the session now. We want to have a last remark from you, from all the speaker, and from our president and vice president as well. So, what you would like to tell the people who have been attending this webinars?
Yeah, in fact, the neonatologists are the people who can take the country forward. They have a very, very big role, and from technology, they take knowledge. That is my comment. Use skills, be humble, and try to do your best, because when you help a mother with breastfeeding, it is so satisfying. No amount of praise or money can bring it to anybody. It's so self-satisfying and it keeps you young throughout your life. Thank you.
Can I add?
Asha ma'am, please ma'am. Remark from your side, ma'am.
Breastfeeding is the best investment, and breastfeeding is the best health insurance policy which you can gift your child. And another thing is, breastfeeding should have some budget allocation in our government organizations so that it can take off. You know, it's just that a few committed people are doing it. The skill of breastfeeding has to be learned. Before my time, I want to transfer the skill to some people. Professor Nirmala Kesri always never accepted a garland on the dais, because she always used to say, until and unless I create 3 Nirmala Kesris, I will not take the garland. At that point of time, it was Dr. Banapurmat and myself, and towards the end, she said, I'm still watching Guru Prasad. Maybe now, but it is too late. So that's the difficulty of creating committed people, especially in the field of breastfeeding. So this is my message, and I really would like to take up the idea of doing an online training for the nurses, but unfortunately we will not be having this practical sessions. But at least we can finish the theory part and think of the practicals later if and when COVID permits. What is happening? Prashant, you're frozen.
Madam, I think, yeah, he's frozen. Probably, ma'am, you can go ahead, ma'am.
Yes, that's my message. Now we'll ask Rupa what she has got to say.
Yeah, Dr. Rupa, madam, please go ahead, ma'am. I'll just take over. Please unmute Rupa, madam.
Hello, ma'am. Rupa ma'am, over to you.
One last word.
Yeah,
Anviti,
last. Ma'am, kindly unmute yourself, ma'am.
Yeah, can you hear me now?
Yeah.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
I just want to add.
Yes, ma'am. Kindly unmute.
I want to say that breast milk is the best. There is no substitute, as sir and madam has said. So if we want to make our babies feed human milk. If the mother's milk is not available, at least make a provision of donor human milk, and at least our government takes up the task to build up these milk banks at all centers, like how Rajasthan and Maharashtra has done. That's all I can say.
Yeah. Kotreshi sir.
Hello,
Kotreshi sir. Yes, sir.
Prashant. I'm very happy. I'm very happy today. Can you hear me, Prashant?
Yes, sir. Yes, sir. Go ahead, sir.
I am very happy today. One day, when we messaged from Dr. Balapurmat, our professor, and 11 o'clock, I called Prashant and Dinikar. So we had a discussion, and definitely would like to have a webinar progress on this breastfeeding week. So I am very thankful to sir and Dr. Asha and Dr. Rupa Bella and OBG fellow Dr. Patel, and even IMA is involved by Dr. Madhusudan Karinu, and UNICEF supported for this wonderful preventive aspects of newborn care. And I very much appreciate. I want to go, as Dr. Barapurpat was saying, the NNF should become a pillar of this breastfeeding support. He's right. Definitely, we'll take these points now and in my center. And I'm very happy because I never imagined such a wonderful things is happened in a wonderful way. Very happy for all the speakers and all the faculty and all the viewers. And especially my boss, Dr. Prashant, has done a wonderful job. When I call them at 11 to 11, I'm very much thankful for this work done by them. And on behalf of NNF, we support for the breastfeeding support throughout Karnataka and my center. I'll give a word to one of person. Over to Prashant.
Kishore sir.
Yeah, good evening, everyone. It was a fantastic evening with scintillating discussions. But I always want to take what we can do better from today for the future. So I thought I'll tell the practical experience. When we started Cloud9 13 years back, we wanted to train 2 lactation consultants for 24/7 service. And we found it very difficult because, as Asha said, the IBCLC course was very expensive. The nurses couldn't afford, and we were a very young organization. We didn't have that kind of money to train 2 lactation consultants by paying 7 lakhs fees. We tried to do a short course, and it was very, very difficult. After about 2 or 3 years of struggle, I got 2 of our nurses trained with IBCLC in Perth, which was much cheaper in Australia, and I got them certified. Subsequently, those nurses have been doing a certification course of Cloud9, which has been done by 200 nurses. But because it's not recognized by anything, we are using them only for Cloud9 nurses in different branches. So theoretically, it is possible to do the courses everywhere, but it's very, very difficult to get an online course for nurses in India. And in fact, I don't know how many of you read Deccan Herald. Today, I'm very, very proud. One of our chief lactation consultant has written an article in Deccan Herald, and that's a testament of how much the nurses can offer. So I think now that we have a fantastic active NNF Karnataka group, the syllabus which we have prepared for Cloud9 certification course, we will get it scrutinized by experts like Asha, and we'll start a NNF course, at least, if not anything else, for the nurses. So we'll take it further because I think there's a huge demand for the nurses to do lactation consultant course. It doesn't have to be an IBCLC course. It doesn't have to be extensive course. It's a simple certification course which will give them lot of teeth to practice in day-to-day nursing homes and peripheral centers. So I think under Kotresha presidency, and we have the structure, we will try to implement this as soon as possible. We hear you, nurses, and we'll do this as soon as possible under NNF Karnataka. Thank you very much. Over back to you, Prashant.
Yeah, Prashant.
Thank you very much. Yes, sir.
Just a word.
Yes, sir.
Your idea is an excellent one. There's no doubt about it. But whatever course is being done, there must be at least for 6 months a monthly periodic review of the people who have been trained. Otherwise, the whole purpose gets defeated. Only then they become confident with their skills. As he rightly said, it took 2 to 3 years to train a nurse on the job. All these things don't happen overnight. It has to be nurtured, built on a day-to-day basis. So every NICU in Karnataka, in India, has an opportunity to train its nurses. They should do it for grassroots and start slowly growing up, bring in a QIP, quality improvement program. That's the best thing to be done.
Thank you very much, sir. Nikhil, from UNICEF side, would you like to give a message? What are the plans you have with us? Any message from Dr. Sanjeev?
Yes, sir. On behalf of UNICEF and Sanjeev sir and my other colleague, Dr. Sri Krishna, unfortunately he couldn't join today because he lost his father recently. But from UNICEF, what I would like to say, this was, I think, the first initiative, one of the best initiatives, I could say, bringing everyone on the platform together. So we have the IMA, IAP, FOXY, NNF Karnataka taking the lead to do this. I think this is a wonderful initiative. On this, I think no better team can unite all of us, because the child when is born is with the mother, and we cannot rule out mother and child separately, like even Dr. Sanjeev pointed out. So bringing both the obstetricians and the pediatricians together is always a win-win situation for all of us. And breastfeeding week, we all come forward together to celebrate. I think we must take this louder. I think we need to do this much more. I think all the nurses actually have been requesting for these curriculums. I think even midwives could play a great role. From obstetrician's point of view, I think we have been talking about midwifery programs recently, which Government of India also has started recommending it. So it's very similarly, probably even the Cloud9's initiative of lactation course also probably can change or can be incorporated somewhere in future down the line. Thank you, sir. Thank you. Thank you all.
Thank you. I think when it comes to World Breastfeeding or Breastfeeding Initiative, the famous quote of Sabka Saath, Sabka Vikas will aptly suit for this. Definitely, we will take all the suggestions, and we will try to pass on, create a course which will enrich all the nurses and healthcare workers, the doctors, and even the parents about this. Thank you very much again for sparing time and giving your valuable time to us and teaching all. Sir, I would like to look forward to similar sessions in the coming days as well. Thank you. Thank you. Have a great day. Have a great day. We will close the session now. Thank you. Thank you, one and all. IAP, BPS, KSOGA, PSOG, all the association who have come forward to help us, and UNICEF. Thank you. Thank you. Thank you, sir. Thank you. Thank you. Thank you. We'll close the meeting now. Thank you. Thank you.
Thank you, Prashant. Thank you.
Thank you, sir. Thank you very much.